Good morning, everyone. It's Dr. Charlotte Hodges. I wanted to continue my series on what to expect with surgery. And today we will do part 5. Everybody's favorite, what to expect weeks 3 and beyond. Typically by this time, everybody is sick and tired of soups. And if they never see another soup in their life, it won't be too soon. So, good news for you. You now can chew things, sort of. So week 3, this is when you can start your soft food. That's going to be like grits, oatmeal, mashed potatoes, cream of wheat. We were actually laughing about cream of wheat in the OR. I'm like, who eats cream of wheat? But apparently a lot of people like it. So go for it. You can do yogurt. You can do flaky fish like tilapia, sea bass, catfish. Just make sure that it's baked, not fried. If it's crispy, it's gonna mess things up. It needs to be nice and soft. You need to pretend like you have no teeth. So basically what you would eat if you were 6 months old or if you were 96 years old. So let's see what else. If you want to do refried beans, I know when my husband had his surgery, sorry, this car coming up behind me is going fast. When my husband had his surgery, we would go to Mexican restaurants and he would get refried beans and then put a little bit of queso, the liquid queso, not the shredded cheese, over his beans. And that worked out really well for him. But make sure it's the soft refried beans. You can do a ricotta bake. I have actually a really good video on a ricotta bake. It is so good. I will tell you, on the internet, there are a plethora of different recipes out there for your soft diet. Now you can also finally do pudding. You can do jello. But more importantly, what are the things you cannot do? You still cannot do bread, chips, popcorn, crackers, pork rinds, muffins, any bread product. And it doesn't matter if it's gluten-free, it's still a bread product. It's going to get stuck. I do not want you trying ground beef, sausage of any sort. I really don't want you trying any baked or boiled chicken. If you want to do a meat, you can do a flaky fish, or if you want to do chicken in a can, because chicken in a can is real flaky. Now, if you want to do like a chicken salad or tuna salad, you can add some mayo. Some people will add avocado because they don't like mayonnaise. But you can add mayonnaise to it, or avocado. And if you like the taste of the relish, you can add a little pickle juice. However, you cannot have the relish. That's going to be too dense. Also, when it comes to eating fruit, you can do like banana, and you could do applesauce or any pureed fruit. I don't want you doing any stringy fruit like some of the melons. I don't want you eating berries because the skins are going to get stuck in your stomach. Let's see, what else? I'm trying to think of the things that people will try to eat, and what they usually will tell me is, Dr. Hodges, but I chewed it up really, really good. And I'm like, no, you didn't. That's why I'm pulling it out during your EGD. So please don't advance your diet too soon. You will have the rest of your life to partake in a wide variety of dishes. Give yourself this full 6 weeks to heal. You will not regret it. I will tell you, typically by the end of week 3, you should definitely be to goal with your protein, and that's even my duodenal switch patients. If you are not to goal with your protein, by this time you will be quite nauseated. For my men out there, you will finally get a taste of what morning sickness feels like. Spoiler alert, it ain't good. So you might feel a little dehydrated. You'll feel icky all over. You might even feel like things get stuck. And I think I'd mentioned this on my last video. It can sometimes be a little bit difficult for me to discern whether or not your difficulty swallowing is secondary to a stricture, so a narrowing between your stomach and small bowel, or just along your sleeve. If it's due to a stricture, or if it's just due to your lack of protein. Now, sometimes if you do have a stricture, that is going to prevent you from being able to take in your protein. And so you kind of get a double whammy. And that is also why it's so very important that you do not advance your diet too soon. All it takes is one time. One time is enough to mess up those primary bonds that are being laid down. And then as you heal, you'll get a stricture. And it's one of these delayed presents that you will get, because what you did in week 1 or week 2, it doesn't show up until week 4. And I find that if I'm going to be doing like a series of EGDs with dilations, it's typically in November, December, and January, because frankly, people have just advanced their diet too soon because of the holidays. So please use week 3 through 6, that's a total of 4 weeks, to be to goal with your protein, get creative with your soft foods, and know that it won't last forever. So I hope that this has been helpful. Feel free to share this with your friends, and don't forget to subscribe. Bye.